Hi, it's Tom here from Running Physio. Today, I wanted to talk to you about a different aspect of our treatment of patients in general and also athletes that often gets underlooked, which is thinking about the recovery aspect of things. Now, a lot of people will put a lot of planning into how they train, maybe into how we encourage people to do their rehab, but the recovery side of things is often forgotten about or neglected. But the recovery side is so important because that's where we think we get a lot of our positive adaptations. So in this video, I'm going to be talking a bit about physical and mental recovery strategies that you can use, not just with people that are sporty and athletes, but also these are going to be applicable to other patients as well that may need to focus on the recovery aspects of life. Also, hopefully there might be a few insights here that might be interesting to you personally. We're all juggling busy lives. We've all got lots of different stresses and strains, many things to juggle, and perhaps there'll be one or two things to come out of this that might be useful to you. As ever, I look forward to your comments and ideas, your replies and suggestions afterwards, and I've put a link to our free running injury videos on Achilles tendinopathy, lower back pain, iliotibial band syndrome, and loads more. So let's start first of all with an important concept here is we often separate out physical and mental health into these two separate things. And we do stuff to help physical health and we do stuff to help mental health. But the truth is that they're massively intertwined. You can't pull them apart. So strategies designed to help with our physical recovery will likely have benefits to our mental health. And strategies maybe aimed more towards mental well-being are going to have positive effects on our physical health as well. And we see that through some of the research. We see, for example, that stress and mental fatigue impairs physical performance. It impairs our ability to respond to exercise if we're very stressed when we're doing it. It's also been found to delay healing. In wound healing studies, stress can delay healing by up to 60%. So it has a big physical effect as well as obviously a mental health effect as well. And what we choose to do with our bodies, the physical fatigue levels, our lifestyle has a knock-on effect for our mental well-being. So these things are very much intertwined, and I think it's important for us to recognize that and hopefully help people get the best benefits out of both. So let's start with some recovery planning. Now, I have a phrase with this, which I often use with my runners, which is if you want to train like an elite athlete, you need to recover like an elite athlete. And this is something that often, as I've said, people neglect. They plan lots and lots of training in there. They don't really give much thought to how they're going to recover from that training. So we can look at this at multiple levels. So we can think about their weekly structure and planning in recovery days within their week. It may be that you want to put one in after the longest run, for example, to give them a chance to recover, or prior to the fastest session so that they're nice and fresh for those interval sessions. So these can be planned into their week. You can also plan it into a 4-week cycle. So it's quite common for us to suggest people perhaps build their training for 3 weeks and have the 4th week as a recovery week, maybe where they drop it by between 10 and 30% in terms of total training. So it's planned in there. It doesn't happen by accident. It's not something that we stumble across. The recovery is planned within their training. And the best marathon training programs, half marathon training programs, they will tend to include recovery weeks planned into the schedule because it's very difficult just to build week on week. Now, of course, we know that sport is part of life, not all of life. So actually, we often want to plan this recovery around life itself. So perhaps you plan in a recovery week when you know work life or family life is especially busy, or when you know you're going to be very fatigued. I was working with a female athlete recently who said that at a certain point in her cycle, she would have very high fatigue levels. So she planned her recovery weeks in to meet the needs of her menstrual cycle. So she was having a recovery week when her fatigue levels were at their highest, rather than trying to push herself through that. So he's looking for flexibility. It's a little bit of planning. And basically, the harder you train, the harder you need to recover. And this isn't just true with sport. I believe it's true with life. If you're working incredibly hard, you're working very long hours, you're very stressed, you've got to plan in recovery for that, because it's not sustainable for us to manage that forever. So think about those recovery strategies, even outside sport, giving people the opportunity to plan in rest and recovery and downtime. And this can be, again, thinking flexibly. So in those recovery weeks, rather than getting people to do their rehab 3 times a week, which is what we might want in a building phase, could they just do them once that week to focus on maintenance? Because once a week strength work is quite effective for maintaining strength. So we can plan their weekly schedule, we can plan maybe 4-week training blocks, we can adapt it around work, we can even modify the rehab to give people a bit of a chance to recover and reduce those workloads. And that's likely to have benefits both physically and mentally. Now, when I was doing research into the recovery process, I was looking to see what are the useful recovery strategies I can share with you, because there's lots out there. You've got things like cryotherapy, you've got things like massage, you've got things like compression garments, and they all maybe will have an effect, but generally in my research, I found these effects are fairly small. So really, the things I will get people to focus on are the simple strategies that will work well. They don't cost the earth, but they're things people can do themselves. So number one, most important strategy we have for recovery is sleep. Sleep, if you could sell it, you could sell it for a huge amount of money, because it has so many positive effects for us, both physically and mentally. The harder you train, the more sleep you would need. So we encourage people to aim for 7 to 9 hours of quality sleep per night, and try not to sacrifice sleep to train more. Of course, people do that. They get up early in the morning to squeeze in more training, or they train late at night. That's okay, but you've then got to plan extra recovery in there to compensate. So number one strategy is sleep. Number two would be active recovery. Now, on those recovery days, it doesn't mean you've got to lie in bed and do nothing. Well, they can if you want to. That sounds quite appealing at times. But that it can be active recovery. Go out for a walk with some friends. Do something physical if you want to loosen the body off. But it should be really, really easy, low-level effort stuff that just gently gets the body moving, feels good, and helps you with your recovery. It's not another chance to squeeze more training in. So our sleep and active recovery strategy is very simple. And the third one would be downtime. Now, if you're watching this, do you get enough downtime? I think a lot of us now, we live very busy lives and we squeeze in little bits of time for ourselves when we can. But I think it's really important actually to have some downtime away from the responsibilities we all carry, responsibilities for work or family or, friends perhaps as well. So I think plan some downtime in there. And if you're working with athletes, encourage them to plan some downtime away from their sport, socializing with friends, looking at other things that they're going to enjoy and find really, really valuable. So 3 simple strategies in there that are important for recovery: getting some downtime, sleeping well, and using active recovery strategies. Now, for the last part of this video, I want to focus a bit more on mental health. Now, this is something I feel very passionate about. I think it's something that we still perhaps aren't good enough at talking about with each other and with our patients. But before I delve into this, I want to say, of course, I'm not a mental health professional. I'm not a counselor. I don't have any qualifications in that realm. So if you're struggling with your mental well-being, or you're working with a patient who you feel may be struggling with their mental well-being, very, very important to get the help they need. Get them to perhaps speak to their GP or see a counselor. Sometimes we do need to escalate things to get more urgent care for people. But really important point before we delve into the rest of this video is make sure people have got the appropriate support in place. Very, very important. And if you're watching this and you feel you're struggling, please reach out and seek help. It can make all the difference. So let's talk a little bit about the mental health side of things. Now, there's lots of estimates out there. Approximately 1 in 4 of us may have a mental health condition that we're looking to manage. And in many cases, that's being done silently. So what I thought we'd talk through now is some of the features that can go with that, some strategies that we can use. And this is largely based on my experience, my reading and things. So don't take this as set in stone, but there may be some things you'll take away that might be helpful for your learning, might be interesting for you. So let's start with a common feature that many mental health conditions, certainly things like anxiety, potentially depression, share in common, which is the tendency to have these automatic, very negative thoughts. Now, we think most of us have these thoughts through the day, and many of us are able to ignore them. They come and go. They're almost like a product of the brain. It will fire out thoughts all the time, and some of those will be negative. Now, when we have perhaps an issue with our mental health, perhaps something like anxiety, our relationship with these thoughts can be really quite different. And it can be helpful to identify common kind of themes within those thoughts so you can see them for what they are. And that's one of the key things for in my experience, for managing mental health, is recognizing that it's just a thought, is not a reflection of reality. And the more you can recognize the characteristics of it, the better able you are to not get too wrapped up in it. So here are some of the characteristics of particularly negative thoughts, again, based largely on my experience in reading. So these can be things like focusing on worst case scenarios, really going down that extreme level of thinking where we think the worst possible situation will happen. Might be what if thoughts. And we often have a lot of these. What if this happens? What if that happens? It might be that we're starting to predict the future. We're starting to think about events that will happen in the future. If we're doing it with a very negative mindset, it's quite common that we're going to predict it in a very negative and scary way. Or we might be dwelling on the past, thinking about things that have happened previously. Now, neither of these things is something we've got a great deal of control over. So we try to encourage people to think more about what they're managing presently. You know, what's on your plate at the moment rather than what you imagine you might have to deal with in the future. These negative thoughts might involve guessing what people think, assuming they think certain things about you or a certain situation. There might be shoulds. I should be better. I should be able to do X, Y, and Z, placing unrealistic expectations on yourself. And there might be what I call the overnight expert thought, which is all of a sudden you're worried about something and you decide you're going to do a bit of Googling, and overnight you think you're an expert in something incredibly complicated. That means, you know, you're actually getting more and more confused about it rather than finding the answers. So if I can try and give you an example from my own experience, we had a lot of building work done. And shortly after the building work, we got a lot of plaster cracks. Very, very common, nothing to worry about normally. But of course, my brain was a little bit anxious about it, so went to the first worst case scenario. Oh, these plaster cracks, it must be a sign of subsidence. The house is going to collapse. It's going to be a nightmare. And then the what if from that, what if the house insurance won't cover it? Well, you know, we'll be destitute, you know, we'll have no money, we'll have no home. You can see the worst case scenario unfolding even further, predicting the future in that as well. And I then did the overnight expert thing, get on Google. What are signs of subsidence? Give that a Google. Suddenly I'm trying to become some kind of surveyor with a quick Google search. And all that just leads to more and more anxiety the more you get trapped in things. Now, with our patients, this might be around thinking about pain. And we want to try and see if we can identify if that's the case. Are they thinking about worst case scenarios with pain? Are there a lot of what if worries about their pain? Are they predicting a very negative future for themselves about their pain? Are they saying they should be able to do X, Y, and Z? Have they done the quick Google search and have actually confused themselves with the information that they've gathered? So this can be part of someone's concerns, and it's a hidden part in many cases. They won't necessarily volunteer this to you because they might be embarrassed about it, or because sadly one of the things around mental health is we often internalize it rather than seeking help when we should do. So if you're working with patients, I think it's a good idea to talk to them and ask them, how are you in yourself? How are you in terms of your mental well-being? Is there anything on your mind at the moment you're finding yourself worrying about a lot? Is there anything you're concerned about with this pain that we can talk through and explore? And you might try perhaps an outcome measure, something like the pain catastrophizing scale, which actually will help you identify a bit more if they're really ruminating and worrying and thinking about their thoughts a lot. So let's stay with this idea of negative thoughts then, and have a look at how they can play out over time. Now, This little graph here that I put together, we've got anxiety up the side and time along the bottom. And what this starts with is a negative thought. Now, if we look at the blue line here, what we might see is that many of us might have a negative thought, maybe something like I've talked about, this idea of, having plaster cracks and thinking the house might collapse. And that gives us a little peak in anxiety, but then the anxiety subsides. And this is a very important thing to recognize, that anxiety, if we allow it to, will nearly always subside given time. So that may not be too distressing for this person. A quick thought, but we don't dwell on it. We're able to focus on something else and the anxiety settles. That blue line you can see there. For some patients though, for some people, it may be more the green line, the second line you can see, that we have a negative thought and they have a big anxious response to it, perhaps because it represents something that's more important to them, or maybe a thought that goes against some of their core values, and they have a bigger anxious response, a bigger sensation of anxiety and distress. This might actually kind of cross the line into feeling overwhelmed. And that is a horrible, horrible feeling, to feel overwhelmed. It's very difficult to pull yourself out of that. And in that feeling, it's very, very difficult to self-reassure and be logical about that situation. So what may happen is that distress, that anxiety may be prolonged before eventually coming down sometime later. The red line above that can be a similar response, but with a slightly different sort of take on it. So we have that negative thought. We have an increase in anxiety. We see the spike in anxiety there, that person feeling overwhelmed. And then they start to ruminate on it. They start to think about it more and more. And unfortunately, then we get these secondary thoughts that come in, which spike the anxiety again, and they can keep going again and again. So we can stay in rumination. We can feel very distressed by these thoughts. And we can see that with my example with the plaster cracks we talked about earlier. That first thought of, does this crack, cracks mean we've got some subsidence? Secondary thoughts of, what if the house insurance doesn't cover it? Other thoughts of, what would that mean for our future? The anxiety then doesn't settle, it stays with us, and it's very difficult for people to manage in this situation. Now, if you are then feeling very anxious about something, maybe very anxious about your pain, perhaps if you're a patient, maybe anxious about something else, reassurance on its own when you're in that overwhelmed state isn't necessarily very effective. And I think sometimes if patients have seen lots of different therapists and have lots of different stories told to them, our reassurance isn't going to be necessarily enough for them to settle and come out of that distressed, overwhelmed state. So we might need to look at other tactics. And I think pain will often play into this as well. So it might be that instead of this graph that we've looked at here, starting with a negative thought, that it actually starts first with pain. And then the thoughts around pain kick in and push us into this distressed, overwhelmed state. So I think this can be really valuable to explore in people that are really struggling during their flare-ups. And I've had some good conversations with patients where they'll say it's not the intensity of the pain that bothers them, it's the distress that comes from the thoughts around that pain. What does it mean? What does it mean for my future? The what ifs, all those kind of negative thoughts we've talked about can take them to a point during flare-up where they go into rumination, and actually that anxiety either stays very maintained or progressively gets worse over time. And that is a very, very difficult state to be in pain, to be very distressed, to be overwhelmed, to not be able to stop thinking about it is incredibly difficult for people to manage. So it might be as part of their flare-up management, we need to identify that, as we touched upon, by talking to them, maybe something like a PCS, ask them where their mind goes perhaps during flare-ups, and then looking at strategies that we can use to help. Now, as hopefully you're getting a message from this as we're talking, you can see how complex this is, how complex mental health is. And this is why I think it's so valuable to involve counsellors, GPs. Don't take this all on your shoulders. Recognise the limitations of your experience. So I would, encourage people to seek some specific help for this. But there may be, again, some strategies that they could work through with their counsellor, some different things that they can do. So it might be that we look at things like soothing strategies. Now, these can help calm the brain down from those anxious states. It might be that if we can help people to identify those negative thoughts, that they can then choose to take their focus elsewhere. Now, this is not easy to do, but if you are starting to have negative thoughts, we know the anxiety associated with them will tend to reduce in time if you can pull yourself towards something different. So choose your focus. Where might you take your mind when you're in this state? And again, I think this is applicable to pain. So rather than it being pain focused or negative thought focused, could we make it focusing on valued activities that you want to do? Returning to sport or running, or in non-sporty patients, getting back into valued activities, walking, socializing, whatever they want to do. Make it about focusing on something more positive that's useful for them. Experience of flow can be really helpful here. Now, this phrase, my understanding is, if you are doing something that fully distracts you from your thoughts, it gives you this sense of flow where the time passes very quickly, and this can be quite useful. Now, for me, I find actually playing on a computer game can do this. Because you're very involved in that game, it gives you that sense of flow and maybe pulls you away from focusing on your thoughts and gives that anxiety an opportunity to settle. So do they have flow activities that they can do? If they're very distracting, they can often pull people's focus away from pain as well. Could we do a little bit of daydreaming about something nice? If I find my mind wandering off towards very negative thoughts, I'll try and push it towards a daydream of a holiday I might like to go on, or something nice I might like to do with the family and what that might involve. Much more pleasant, and you can get really into thinking about the aspects of that. And again, in time, that anxiety will settle. Might we want to use relaxation techniques to help calm the brain down? I'll talk a little bit about that more in a second. Time in nature can be very helpful for people. That has been found to help mood. So getting out there in the countryside or by the seaside, socializing, time with friends, talking, sharing your concerns. Enjoyable distraction. There are lots of options that we have that we can try and take our attention to instead of perhaps ruminating on very negative thoughts. This allows that anxiety to settle, and that might actually give us an opportunity then to approach it in a way where we're a little bit more centered, perhaps a little bit more able to deal with it. Because one of the things that's so difficult if you do have problems with your mental well-being is that when you're in that overwhelmed state, it is almost impossible to reassure yourself. Logic doesn't seem to have much power when you're overridden with anxious emotions. So sometimes it's better to focus on calming those things down first and then perhaps allow yourself to work through it. Or in many cases, you might find once that distress and anxiety is settled, you no longer feel you need to work through it. Now, let's bring this back a little bit more to this idea of recovery. Now, we know if you look at the recovery literature that we need to recover from both the physical and emotional demands of our sport and day-to-day life, which is why I'm talking about the mental health side of it here, to recognize how important that is and how it may be a piece of the puzzle for people with pain. It may be a piece of the puzzle affecting their performance. It might be having a huge impact on their quality of life. So it is important to try and recognize that. But there are also lifestyle aspects to this as well. And this is very important too. We have gone through an awful lot of stressful times in the last few years. And to some degree, some of the strategies that people are recommending are being used as almost a little bit of a mask for that. This sort of idea perhaps of toxic positivity, it sometimes gets called, where people are placed in very difficult, challenging work situations, for example, and then it's been made their responsibility to cope. They're being told that they need to be more resilient rather than recognizing how challenging their situation is at the moment. So I think before we think about strategies, we do need to recognize that actually sometimes people can be in an overwhelming life situation where that is a big driver for them, and we need to be very careful that we don't try and place blame on them and tell them they should be coping, when actually it's quite human to feel overwhelmed by overwhelming circumstances. But we might have some strategies that people may choose to use is alongside seeing if they can help with that circumstance. So that's one of the first strategies here. Have a look at the lifestyle situation. See what can be changed in terms of the work situation. See if you can set boundaries in some situations. Not always easy, but those of us that work in caring professions, we often are brilliant at empathy. We can often listen to people and really take on board their struggles, but we struggle ourselves to set boundaries with people. And empathy without boundaries is a recipe for exhaustion, because you take on lots of other people's problems without ever setting any boundaries to allow you yourself time to recover. So part of it might be people looking to see where can they set boundaries, for example, on people's expectations on them at work or at home. Can they set some boundaries in place there to lessen the load on them? Can they look to change what things are perhaps causing a lot of stress and de-stress in their lives to make those things better? What can they change in that situation? What other aspects of lifestyle might they be able to change, particularly sleep we've talked about, or things like alcohol consumption? Now, a lot of us, and I include myself in this, we like a glass of wine to help us relax. But unfortunately, excessive alcohol consumption is really not great for our mental well-being. So if we're using it as a coping strategy, that may well have a knock-on effect on our ability to cope with our mental well-being and our anxious thoughts. So first step might be looking at lifestyle. What can be changed? Can we get more sleep, more recovery? Can we think about just taking better care of ourselves where we can and changing what we can with the stressful environment perhaps that we're in? Strategy two alongside this is looking at soothing options. And I would encourage you, if you're struggling with your mental well-being or patience, to think about making a little list of what things actually soothe you and make you feel more relaxed and help calm things down. For me, I like going for a run. I like being outside in nature. I like time with my family. There's something deeply soothing about a cup of tea and a good biscuit. I don't know why, but these things are good calming strategies. But also working, perhaps with talking to a therapist if that's helpful, or talking to a friend, or actually using formal relaxation strategies. Mindfulness, meditation, things like those can be very helpful. Now, part of the reason why they're helpful is not just because they make us acutely feel a bit less anxious, but because they can help us work with those thoughts that we've talked about that can lead to rumination and distress. So a lot of relaxation techniques, meditation techniques will ask you to maintain a focus on something, maybe your breathing, while you'll notice the thoughts coming in and coming out and trying to hijack. And so it's not just about relaxing is part of that, but it's learning that skill of not letting that thought pull you away in the direction it wants to, because that can lead to the rumination, distress, etc. And you can choose what you want to focus on. So I'm a big fan. I do daily relaxations. I find them very helpful, just as a 10-minute one that I like at the moment. And I notice I feel a lot better afterwards. And at the end of the relaxation, I will then choose, what do I want my focus to be today? Do I want it to be worrying about cracks in my plaster that we've talked about, that in the end were nothing to be concerned about? Do I want it to be distracting me from the things that I value and want to do? Or do I want it to be maybe work? Maybe I've got a busy work day that I need to focus on, or time with family, or time with friends, or time to myself. So then that state, when you're more relaxed, you're more able to do that. And that can be helpful for us managing these thoughts. Now, the final thing to talk about here, again, please note these are based on my experience in this area. So, they're not set in stone. Please seek help if you're struggling with these things. But is trying to change your relationship with your thoughts if they are a problem for you. And step one is recognizing it as a thought. Now, a lot of these thoughts will come with an emotional energy to them, which can really overwhelm us. Quite often, that is because it's something that's important to us. It's something that matters to us a lot. So it feels very important to get engaged with it and try and make ourselves feel better. But it doesn't change the fact that essentially it is still just a thought. It isn't necessarily reality. So step one would be to try and recognize it's just a thought. Step two, choose what you want your focus to be on instead. Gently pull yourself towards that wherever you can. And sometimes it does come down to managing moments, because it's so easy for me to say this. But I know those of you that are listening have perhaps struggled with anxiety or aspects of your mental health. When you're in that moment and you're feeling overwhelmed, it is the hardest thing to pull yourself out of that and focus on something else, which may be why it's better to focus on doing some relaxation in that moment to calm down that distress and then allow yourself to focus on something else and manage just each of those moments each day. Don't get too hooked on tomorrow, but just manage the moments however you need to if you're struggling with your mental well-being. And then the final thought with this is think about a graded exposure. If there are things that are causing you stress, if there are particular things that you're stuck on, maybe think about how you can gently work on them one thing at a time, and work through it. So for example, I know lots of people struggle with compulsions, and obsessive compulsive disorder, and that can involve things like checking. So checking doors, checking ovens, checking plugs, and needing to do it repeatedly to feel reassured. Quite often, again, because the negative thoughts are in play, saying if you don't check the door, you'll get burgled, or if you don't check the oven, the house will burn down. But what you might be able to do with that with your checks is actually look at what is the least distressing one. Is there one in there that actually, if you really look at it, it's not too much of a problem? Could you start with that? Could you say, okay, this is the one I'm going to tackle and I'm going to gradually reduce the checking, which leads to more distress actually over time. And that's going to be my graded exposure. That's my first one. I'm going to work on that. And as I'm feeling better, I might work at other aspects of this that I'm finding more challenging. So we can use that graded exposure as well. Okay, so a bit of a longer discussion than normal here. It is something, as I said, I feel really passionate about. I do want to reiterate again, please, if you're struggling or you feel that perhaps one of your patients is struggling with their mental well-being, do get the help that you need. It's so important. Do talk to someone because there's lots people can do to feel better. But to summarize what we've said then in terms of what are the key strategies for physical and mental recovery, it's got to be about planning your training to include recovery in your training week and in also maybe your 4-weekly schedule. It's got to be about looking at life load and stresses and seeing if we can lessen some of those stresses wherever possible. It's also got to be about taking good care of our physical health in terms of lifestyle, getting enough sleep, perhaps not drinking too much in terms of alcohol, and then having some strategy for your own mental well-being, whether that's around relaxation, mindfulness, seeing someone to talk through things, or starting to look at the relationship you might have with some of the persistent negative thoughts that actually do affect you or your patients. Okay, thanks again everyone for listening today. I'd love to hear from you if you've got any suggestions, any ideas. If you're a counsellor listening into this and you think perhaps I've got some of this incorrect, perhaps because I'm only human and I'm not a mental health practitioner, let me know in the comments. I hope you found some of this useful and interesting, and I'll look forward to speaking to you again very soon. Thanks again for listening. Bye for now.